Hi, my name's Beth. Today I'm going to be showing you how to assist someone to clear their airway using a Yankauer. So in this scenario, I've got Mrs. Murphy who's going to exhibit some signs of respiratory distress. So I'm going to find her laying in bed, kind of coughing, gagging, making some gurgling noises, and I'm going to show you how to manage that. So upon entering the room, you're always doing your hand hygiene. Just there. And always going through in your head your Dr. SABC algorithm. So upon entering any patient room, I'm looking for danger to myself or anybody else, so something to trip on, water, cords, that sort of thing. And then the danger here is that I can hear my patient having some respiratory distress. So moving on to R, Dr. R. Response, Mrs. Murphy, are you okay? And Mrs. Murphy is sort of coughing, gagging, gurgling. So Mrs. Murphy is responding, but she's also struggling. At this point in time, I don't need to send for help. This is something I can potentially manage myself. If you choose to send for help in this phase, that's totally fine. More hands is better than no hands, but I'm going to try and manage this. So I've done my Dr. S components, and now I'll move on. So Mrs. Murphy, I'm just going to sit you up to assist you with your airway. So I'm thinking airway here. Mrs. Murphy, can you try and cough for me? Big, big coughs. Try and cough. The patient's own coughing is a much more effective method of clearing the airway than anything that we can do. However, if she has ineffective coughing, we do need to assist. So Mrs. Murphy, try and cough for me. I'm just going to grab some gloves. Ideally, you'd be performing hand hygiene before popping on your gloves, but this is her airway, so I'm a little bit in an emergency state. So I'm going to chuck my gloves on. Mrs. Murphy, try and cough for me. Cough, cough, cough. And I'm listening and I'm watching her. So respiratory distress, she's sort of shrugging, she's not breathing effectively. And also I'm looking at her and she's not coughing effectively. I can sort of hear some gurgling. Mrs. Murphy, I'm just going to have a quick look in your mouth, standing away from her. I don't want her to cough into my eye or into my mouth. Okay, I can see a little bit of fluid. Could be vomit, could be blood, could be water, just pulled in the back of her throat. Could also be a foreign body, but I'm going to say for this scenario, it's just a bit of water. She's tried to have a drink laying down. Mrs. Murphy, I'm just going to grab some equipment and help suction your mouth. So all facilities will have an emergency bag behind the bed, especially in acute, sometimes subacute. In this bag, I have a Yankauer, which is a hard wand made out of plastic with a bend in it, and I'm going to use this to suction Mrs. Murphy. I also conveniently have some protective goggles, so always protecting yourself as well. Mrs. Murphy, try and cough for me. I'm just grabbing some equipment to help you clear your throat. So behind the bed, I've got my suction. I'm connecting my clear suction port tubing to the Yankauer and keeping the tip inside the bag. Now I can pull that out. Mrs. Murphy, keep trying to cough for me. You'll see now I'm about to turn my suction up to 100, 150 millimeters of mercury. It's going to be a little bit noisy. Okay, with my Yankauer, I'm going to pop it into Mrs. Murphy's mouth, explaining to her what I'm doing at the time. Mrs. Murphy, just open your mouth for me. I'm going to help by pulling your chin down. I'm popping the Yankauer convex side up, so curve up towards her palate, inside her mouth gently. And once I'm in, I'm going to occlude the hole using my thumb. So I'll suction by moving around. Any fluid, any vomit, any blood, just coming up now. I'm going to take my thumb off that hole and gently pull out. I'll just turn the suction off while I talk. The reason for that is if I was to go inside Mrs. Murphy's mouth, occluding that port, I could potentially cause damage to her oral cavity. So the suction can be quite strong. I don't want to damage her lips, her tongue, her oral mucosa. So you apply your thumb over the suction port once you're inside the mouth. This is quite a hard, solid tube, and I want to be gentle and mindful of her teeth as I'm actually going into her mouth. I don't want to chip any crowns or teeth, potentially give her something else to choke on. So with the suctioning also, I'm only doing it for about 10 to 15 seconds max. So this is as per policy, but it also has its reasons. If you have this inside someone's mouth, you can potentially affect their breathing. It can cause hypoxia. You want to give her a break between the suctioning. So 10 to 15 seconds of suctioning, take it out, let her catch her breath, try and cough Mrs. Murphy. and have a little assessment now too. So I'm going to watch her respiratory rate, her work of effort with this, and also her voice for patency of airway. So Mrs. Murphy, are you okay? So if she hasn't recovered, is still gurgling a little bit, I can actually repeat that procedure. Turning my suctioning on, explaining to Mrs. Murphy, I'm just going to suction your mouth again, Mrs. Murphy. Open your mouth for me. I can turn her head towards me if I need, just so I can see better, visual. Just going to suction, going in your mouth, occluding the hole, suctioning all the secretions, water, blood, vomit that I can see. Taking my thumb off and removing. Now I'll reassess again. Are you okay, Mrs. Murphy? So at this point, either she will have recovered, hopefully, and she'll be able to say, I'm okay. She'll catch her breath a little bit and I'll stay with her. Or if she's not recovering, I'm concerned. I've tried suctioning 2 or 3 times now. It's been a few minutes. I'm going to send for help if that's the case. So by hitting my emergency buzzer, I'm just getting the right people in the room with more equipment, potentially more expertise. It's better to have more hands than no hands. And if she recovers in that time, that's fine. Everyone can go back their way, but always hit that button if you feel like you need to. It's not going to hurt anybody. It can potentially save a life. Mrs. Murphy, now I'm going to give her a chance to recover. So I'm going to pop my Yankauer down, get her to take some breaths and reassure her. You're okay, Mrs. Murphy? Take some big breaths for me. Cough if you need to. While I'm reassuring her, I'm actually assessing her. So I'm looking at her airway, watching her swallowing. I'm looking at her effort of breathing, whether she's using her shoulders, really panting, using some of her subcostal, intercostal muscles to breathe. And I'm watching her respiratory rate. I want her to try and recover from this. So give her a moment and then do a full respiratory rate. So I'll be looking at her breathing. I'm just going to look at your breathing for a minute, Mrs. Murphy. And I'll count at least 30 seconds, hopefully, or preferably a minute of her respiratory rate. Then when I feel comfortable, I'm going to get some equipment to actually assess her more in depth. So I'll need blood pressure monitor, heart rate manually. I'll also need my oxygen probe, check her oxygen saturations, make sure she's recovered. After all of this, I want to let someone know what's happened. So I'm concerned now that Mrs. Murphy isn't able to manage her oral secretions and she's not able to swallow fluid. In my gloves, hand hygiene. So I'll explain to Mrs. Murphy that, Mrs. Murphy, because you're having difficulty swallowing and you had that little sort of choking episode earlier, I'm going to recommend that we don't give you anything to eat or drink until you've been reviewed. So I'm going to put a sign up that says nil by mouth. I'm going to have a chat with my registered nurse, potentially have a chat with the doctor and make a recommendation that you're seen by a speech pathologist. And the speech pathologists are specialists in swallowing and sort of rehabilitation of swallowing potentially as well. So until she's seen by those people, I don't want her to eat or drink because I'm concerned that it's dangerous. So what I will show you now is how to clean the tubing after you've used it, but this is the very last thing on your list of priorities. Okay, I'll be back in just a moment, Mrs. Murphy. So what I'll show you now is how to clean the used suction tubing. So what we'll do is the Yankauers are one-time use. Once you've used it, it needs to go into the bin. I've just kept it inside the rubbish so that I don't have sort of mouth contents on the bed. What I'm going to do first is I've entered the room, I've done my hand hygiene, come into the patient's bedside, saying hello to Mrs. Murphy and explaining to her what I'm doing so that she doesn't think I'm going to suction her again when she doesn't need it. I'm going to clean my hands. And I'm going to pop on some gloves. Okay, so what I've brought back from my equipment room is a bottle of sterile water or water for irrigation. It's sealed, hasn't been opened, and a plastic cup. So what I'm going to do is I'm going to put some of this sterile water inside the cup to clean my circuit. And I'm going to keep this bottle near the patient's bed, reminding the patient that she's not allowed to drink it, letting other people know that she's not allowed to drink it. If you don't think it's appropriate to keep it there, if the patient may not remember they're not allowed to drink, take it away. But I'm keeping it there for cleaning purposes later because I may need to resuction Mrs. Murphy and clean the entire line again. So what I'm doing now is I'm going to disconnect the anchor sucker, put this one in the bin, and I'm going to turn the suction up, doesn't really matter how much, and just suction some water. And you'll see that it actually runs through. And what I want to see is any vomit, blood, sputum, anything that you've suctioned up should be clear from this line, so clean for the next time. This canister here has to be discarded before every new patient or after you've discharged the patient from that bed, or if it's full or if it has contents in it that may be offensive or frightening to a patient. So if you've got a canister with blood, just change it. Doesn't need to be there, just change it. And so that's part of the nursing job, is to make sure you've got clean and working equipment at the end of your bed. And that is how you clean your suction tubing. Gloves off, hand hygiene.